Hi, welcome back to MetaMe. I'm Ritika, and today we are interviewing Dr. Sugerman, who's a a vet.
Hi, Ritika. How are you doing?
Doing good. How are you?
Good. Thanks for having me on.
Yes, thank you so much for joining today. Without further wait, let's just get into the questions.
Yeah.
What is your doctorate type?
Yeah, so mine is a doctorate of veterinary medicine, so a DVM.
And what was like the educational journey to get to that point?
And typically, you go through getting a bachelor's degree, so a 4-year degree, and then it's another 4 years through vet school, and then you have the option of doing an internship afterwards, and or a residency afterwards. You don't have to do an internship and residency, but you do have to do the 4 years of 4 years of your bachelor's, and then 4 years of your medical degree.
Okay, sounds like a bit of a long journey.
It is, yes.
So after you graduated, what specialty did you choose to go into?
I did emergency medicine, so I'm an overnight ER doctor. I did do an internship, and I did mine specifically in emergency medicine.
And was there a certain like motivation for you to choose that specific specialty?
Yeah, I just really like not knowing what's going to be coming through the door. I guess I kind of motivated by the thrill of it. I like fixing things quickly and not having to look at tiny details of things. So emergency medicine really fit me for that. And I also love doing surgery as well as medicine. So that also is great for emergency medicine.
And you mentioned you work at night, so how does that work with like balancing your personal life and your work life?
I don't know if it works well, but it's just a lot of learning how to flip back and forth for your schedule because I do have kids, and so I have to get them to school really early in the morning as well. And it's just learning the best way to be able to flip the schedule so quickly.
Yeah. And so, would you be able to walk us through a typical day in your career?
Yeah. So with when I first walk in, I'm usually rounding. So I'm usually talking to the vet who is on during the day and managing all of the hospitalized patients because I typically take the hospitalized patients as well. So we round on all of our patients. We talk about each one to discuss like what their diagnosis was, the medications, all of the testing that they did, and then after that, I start seeing patients. So I usually will see anything that is a critical patient first. We do a lot of triage, so anything that's closer to dying is what's going to be seen first, and then after that, going to each of the other patients to be able to see them. And usually, when I'm in the room talking to the pet parents, it's a lot of just talking about what's going on with their pet, asking about some some testing that we can do, and then diagnosing them and treating them. The cool thing about being an emergency vet, is we do a lot of our diagnostics in-house, so we get a lot of things back very quickly. Versus when you're doing human medicine or when you're doing general practice, a lot of that is sent out to other places, and you don't get it back as quickly. Yeah, and then in the morning, I just round back to the day doctor.
So because of like the place you work and the type of work you do, what would you say was like a certain experience you've had that really stood out to you in your time as a vet?
I think that the thing that stands out the most is just how grateful people are that there is somebody who's there all night to be able to help their pet. There's definitely a lot of places that don't have an emergency vet anywhere around. I've talked to other people who they've driven 6 hours to come see me because they didn't have anybody else who would see them. And so I think that really stands out to me that people are just so grateful to have somebody to see them.
Amazing.
Yeah.
So you're the first vet we've had on the podcast.
Oh,
So,
cool.
could you explain, like what other, like, kind of like job opportunities there are in like veterinary medicine, like how, like human medicine, there's like technicians and like nurses.
Mhm.
What options are there similar to that, but in
Yeah,
animals?
there's so many things that you can do in veterinary medicine. So we do have like assistants, so people who are trained but do not have a license. You have veterinary technicians who are trained and have a license to practice vet tech medicine. And then you have our veterinarians. You can do general practice where you do lots of vaccines and a lot of management of cases. You can do emergency like I do, exotics. There's specialists like dentistry and internal medicine, critical care, all those things. And then you also have things that don't involve directly being with pets. So that could be things like nutritionists. It could be people who do sales of medications. You could have people who do who work through the USDA or with the Army to be able to help those type of pets, or to do a lot of research. You can be a research veterinarian. So there's so many things, so many avenues that people can go down for veterinary medicine.
That's great that there's so many options.
Yeah.
Um, yeah, so um, kind of continuing with that, so what kind of person would you recommend this career for, like characteristic wise?
Yeah, especially for veterinarians, people always think that all I do is play with animals, and that is not true. I do a lot of talking to people. That is a huge portion of my job, is talking to people and then writing a lot of records as well. So people who are very shy and do not really like talking to a lot of people, they tend to get into this position thinking that they're not going to have to talk to a lot of people, but that's just not true. So I do think it is really good for people who really love animals, but also can you know can do things like solving puzzles really quickly, and who really are really good at interacting with their patients' parents. Because really, in order to be able to do anything for our patients, we have to be able to interact with the pet parents. So I think you still have to be kind of a social person to do this. And for me in particular, I'm really social when I'm at work. I'm really great at that. And when I'm at home, I'm very introverted. So I think that, as long as you can know that at work you can do that, I think that this would be a really good position.
Um, so it's obviously amazing that you get to help your patients every day, but what would you say is like one kind of like con or a little bit of a downside of being a veterinarian,
Yeah,
if
we
there
have a
is
couple of
any?
things. Oh, there are. Trust me. You
Yeah.
have definitely have people who don't have enough funds to be able to pay for their pet's care. That's really hard to deal with because you really want to help that pet, but at the same time, like you can't give away all your services for free. Unfortunately, like we don't have any insurance that's paid for by the government in order to be able to care for these pets. So, a lot of times we end up having to like unfortunately like put pets to sleep because of funding. Other also people can get really angry. They get really angry about the fact that they can't afford something, or that we can't help them with something, or we can't do something fast, or they get really upset because they feel that their pet is the most critical pet, whereas they actually are not the most critical pet. So I think those are two huge downsides to this job. I would say one other one would be it is very long hours. Like I work 16-hour shifts.
Wow, yeah. And so I think we are on to our last question now.
Yeah.
Um, would you have any tips for high schoolers in general if they want to go into this career? Like activities you recommend, or just like things they could start looking into if they want to do this?
Yeah, it is actually a lot harder to get into vet school than it is to get into a lot of medical, like human medical schools. So I
Hmm.
do think trying to do things that stand out, a lot of people will just try to get into working at a vet hospital and feel like that's going to help them stand out. But that's great for experience, but that's not going to help you stand out. So I usually tell people to do some sort of animal that not a lot of people do, like chickens or farm animals. Um, Zoo animals are great, but a lot of times there's so many people who want to work with zoo animals and don't have the experience that it's harder for them to get in. Or what I did was I went and did research. So it looked really good that I had done some research projects and understood research to be able to get into vet school. So I think just finding something that people don't often do can really help you to be able to get in.
And you mentioned like working in zoos. So
Mhm.
I actually wonder like what are the kind of places that vets can be employed at? Like
Yeah,
besides
so
the hospital.
Yeah, you can be employed at the vet hospital. You can be employed at zoos, aquariums. We do fish. There are definitely fish vets out there. You can be employed at, like I said, the USDA or the Army, at research facilities, or even there's a chimp sanctuary that's here where I live, and so we have a vet who works there. So lots of sanctuaries and stuff that you can be employed in. You can do things like working out of your own home too. It doesn't even have to be through a vet hospital. Also had veterinarians who work out of an RV and they travel around in their RV and do their job. So there's definitely lots of options there.
Wow, so like the people who work at home, is there like an option like how like telehealth is there for humans?
Yeah, exactly. So we have telehealth. There's veterinarians that work on like justanswer.com. There's veterinarians who work for Amazon. There are people who do like in-home euthanasias, and so they'll go to people's houses, so they just work from home besides driving to people's houses. And there's lots of different things that we can do.
Wow, yeah. So it sounds like there's lots of options in veterinary science.
Yeah.
Yeah. Okay, so that's all that we have today for you, Dr. Sugarman. Thank you so much again for joining us on the podcast.
Of course, thank you.